Welcome back, everyone, to Ask Sam. I'm going to cover in this first batch the rather long questions. So I'm going to start here with Tim. Tim asks, I've been diagnosed with metastatic prostate cancer, which has spread to the pubic bone and L2. I have not repeated the ADT treatments, to huge disapproval of I guess, by my doctor and oncologist. In the end of April, as I felt the side effects were horrific. Joint pains and feeling lethargic caused by medication. I have chronic osteoarthritis for 20 plus years, 2 hips replaced, left knee replaced. Also in my neck, shoulders, lower back, especially in the morning, hands, fingers, left ankle, right knee. I am 60 kilograms, which is about 125 pounds. Age 69 years, active, cycle, swim most days. I also was diagnosed with hemochromatosis about 10 years ago. I am on Vilasta since January 2022 for the last month, 18 pumps a day. I've enclosed latest blood results. What is causing me great concern, my ferritin equals 1,159. Just to put that in perspective, anything over about 400 or 500 is considered high, which should be less than 400, even though I have had 3 phlebotomies, venesections in the last 6 weeks. Also, my serum iron and transferrin saturation are very high. Also, some of my liver enzymes are outside the recommended range. Testosterone is very high, which I cannot understand as I've been on ADT. Doctor oncologists are no help as they want me to go back on ADT treatment. My PSA is now on the 16th of June, 0.07, increase from 0.03 in March and January. I'm sort of curious, there's a sidelight here. Did you have your prostate removed? Because those numbers are actually pretty good if you have not had your prostate removed. My CRP on 16th of June, the 8th of March, 26th of October were all less than 1 milligram per liter. My alkaline phosphatase, 88, 88, and 117. I've been treated for hemochromatosis for about 10 years, and I have done phlebotomies, venesections 2 to 3 times a year. My ferritin is usually between 150, 250, 350, and then it drops after the phlebotomies to 100 or less. All that's pretty standard. The biggest concern is here on your iron levels, and in understanding how iron is goes from your diet directly into your bloodstream or into your heme or your hemoglobin, your red blood cells. Ferritin is nothing more than a protein that acts like a cage. And when you take in iron, iron itself will convert peroxides in your body into free radicals. So to keep iron from creating a huge inflammatory result and the diseases associated with high iron saturation, ferritin traps the iron. It's like a tank holding water. It creates an inventory of these proteins that's holding the iron. As long as the iron is inside the ferritin protein, it's not dangerous. So, and transferrin is the enzyme that moves the ferritin into producing red blood cells. So, in this question, he has in there that his ferritin level is 1159. That is a high number. Phlebotomies can knock that number down, but the phlebotomy is only dealing with the symptoms of the ferritin. The typical cause is that you may have an absorption issue or an absorption problem. But 2 things to keep in mind that will cause ferritin to increase. One is inflammation and cell damage or cancer death. Cancer accumulates iron at a very high rate, much higher than normal cells. But it's your intake of iron has to be dramatically reduced. no heavily green vegetables, no spinach, no kale, no red meat. Um, and the other very important thing that people seem to overlook when we're faced with this is that high levels of fructose and alcohol cause this same phenomenon to happen. So I would suggest prior to your next ferritin blood work that you no fructose, no fruit, and no alcohol consumption for at least 2 weeks, and see if that doesn't bring your ferritin levels down. Very good question, but people way overlook the effect that sugar and alcohol both have on these types of diseases. Maria asks, will taking taurine be an issue while on Valasta? Taurine decreased uric acid levels, which I understand is a good thing. Taurine can efficiently decrease the elevated xanthine oxidase activities, which may or may not be a good thing while on Valasta. First of all, taurine is a sulfur-based amino acid. Your body produces it. It's found in every cell in your body. So it's just an amino acid. It has really no effect at all on Valasta, on the anti-inflammatory properties or the antioxidant properties of Valasta. So I don't see any problem with it. It's like all other proteins. You don't want to overdo proteins. They have a tendency to gum up your blood a little bit. It's one of the problems with cancer. Cancer is not regulated in its protein production, and that's what causes most, eventually leading to organ death, kidney failure, and that's typically how cancer kills someone, is the protein production gets very, very high and there's no place for it to go. Isam asks, can Valasta help in reversing gray hair and beard, head hair, or at least slowing the rate of going gray? I'm asking since Valasta is a potent antioxidant. Unfortunately, it doesn't. I have no evidence to show that someone's gray hair was reversed by taking Valasta. So that would be very, very nice when you have a tendency to look at this. I've been taking 100 milligrams a day since 2008, and I'm a good candidate for being able to report with a high degree of accuracy that did not reverse my gray hair. April asks, I know Valasta lowers blood pressure. How low can I go and still be okay to take Valasta? Valasta will actually take you down to your normal blood pressure. It will not keep lowering your blood pressure. You have regulating factors in your body, but it does stop the free radical generation that causes elevated blood pressure or hypertension. It will not just keep dropping your blood pressure until you die. So your body will take over and will regulate your blood pressure on the low end where you are becoming normal. The second question here is, can dogs with heart issues and low oxygen benefit taking Valasta? If it's inflammatory, absolutely. If it's mechanical or if it's congenital, all Valasta does is stops the inflammatory response from a lot of these issues. Oscar asks, I've been thinking a lot about Valasta ever since I saw my first Q&A with you. I've been wondering if the product can cause dependence. I'm thinking if this inhibition of inflammation the product achieves could cause the body's own immune system to relax and then cause a backlash if one stops using it. Do you have any data or experience with this? We've not experienced any sort of dependency. The body is very good at maintaining a certain level of inflammation just for communication between cells. We don't see a dependency at all. When, for example, if I go off of it for 2 to 3 days, I'm 69 plus years of age. I begin to experience stiffening in my joints. Right now, I have no arthritis. So I don't know what the dependence of that is. I know that at my age, if I was not on Vilasta, there's a very high probability that I would have sore knees, sore joints. The fact is I don't have any of that. Gia asks, I'm inquiring about any research and information with use for mesothelioma specifically. And most of it's related to asbestos and could be cigarette smoking. In addition, anything that causes some scarring in the lungs. Vilasta will help with the inflammation resulting from that. Vilasta cannot stop the scarring that's already occurred. And unlike the liver, the lungs do not regenerate cells and repair itself. So that can be a chronic, ongoing progression due to the scarring in the lungs. But as far as I know, Vilasta, will help with the inflammation. It will not reverse mesothelioma. Selena asks, I'm a 47-year-old female who was diagnosed with PV, that's Polycythemia vera, I believe, about 3 years ago. I managed to get by with venesection every 3 months and daily dose of aspirin. My iron levels are low. My platelets are high due to the PV, but so far I've managed to stay off medication. I saw that you've had success normalizing blood levels taking Vilasta. I'd love to find the magic cure to bring down my platelets. Is it okay to take while taking aspirin? It is. I also suffer from chronic hives, so I take antihistamines every few days called Zyrtec. Selena, it's probably good if you measure your C-reactive protein. Usually, hives is an autoimmune disorder, and Vilasta should have a very positive effect on stopping those. Antihistamines can propagate the problem. So when you take Zyrtec or any other antihistamines, they have to be metabolized. Well, the products of metabolism is more free radicals. So you can get into this snowball effect where it will auto-accelerate and keep you in a chronic state of hives. And that's being caused by the concentration of free radicals. You might have to go a very high dose of Vilasta for a short period of time to get that inventory knocked down. After which you can start working yourself off the antihistamines and your hives should stop coming around. But each time you get put under stress, you may be very sensitive to epinephrine, norepinephrine releases in the adrenal gland. And when that happens, these hives could come back. But the spike of the fight or flight reflex, the epinephrine, the cortisol, the norepinephrine, they cause a pretty severe inflammatory response. So watch your stress level as best you can, but measure your C-reactive protein and keep it less than 3. Brenda Hitchcock Bunch, Vilasta, short-term memory is a real concern. Also joints and weight loss. Thanks. I'm not sure what the question is there, but if you're having short-term memory and your joints hurt, you're suffering weight loss, usually it is inflammatory. And again, measure your C-reactive protein. Get that number as low as you can possibly get it, definitely under 3. And just see how your body responds to that. Andre asks, I recently had a CRP test done at a local walk-in lab. The result came back as negative. I expected a number. I called them and they said the quantitative result will be back in a few days. They sent it to me today and it states the CRP HS is 0.09. Hopefully it's milligrams per liter. So when you get your CRP, absolutely make sure the units read mg per L. Some labs will report it as mg per DL. If you get something that is mg per DL, you have to multiply that number by 10. So in this case here, Andre, yours came back at 0.09. That's a very, very good number. That's about as low as you can get and still maintain cell-to-cell communication. Should we as Valasta users ask for a regular or high sensitivity when we order this test? Is there a difference? Usually, when you ask just for a CRP, they'll report it as either less than 3 or less than 10. They won't give you an absolute number, or greater than 10. So if it comes back and your CRP says greater than 10, high, you don't know whether it's 12 or it's 200. Just give you some idea, COVID patients, for a mild case of COVID is 200 is their CRP. A bad case of COVID with a bad outcome is about 1,000. So it's a very good number to measure your inflammatory disease state. But always ask for the high sensitivity when you order the test. High sensitivity C-reactive protein will give you a quantitative number. And it's that number that's pretty important. We want to plot that number. We want to look at that number. Steve asks, I took Valasta for months as I have leukemia, CML, and recently started taking protocol for my cancer. Can you tell me if Valasta is okay to take with the protocol? And what is the success rate for leukemia when taking Valasta? There's several different protocols. I take it it's a chemo protocol. It's perfectly fine from everything that we've seen so far. It should not interfere, and it might even act as a in a synergistic effect and improve your overall recovery rate. So keep that in mind. So far to date, now several doctors like to promote the fact that it's an antioxidant and it might negate the chemo effects. Chemo generates a huge inflammatory response, huge. Valasta is not capable of negating that. Valasta operates on a separate protocol, a separate pathway, and therefore the two probably work very synergistically and in stopping the cancer. Jim asks, the hospital staff asked my wife to immediately quit taking Valasta product until after the operation. The only thing she can take is Lexapro. Med folks say they do not have enough knowledge if these products are safe. Should we be concerned about taking astaxanthin up to including the day of operation? We have a lot of data, and so does the National Institute of Health. The fact is that these med folks have no knowledge of it. They're ignorant of it, and they're not taking the time to research it. You can Google NIH and astaxanthin and cancer and heart disease or whatever, but the National Institute of Health has declared this as generally regarded as safe. It's very unfortunate that doctors don't take enough time to learn beyond their point of expertise, and they make wild nihilistic comments like this where they talk about things they know nothing about and haven't done the research to follow up on it. Myra asks, I am currently under treatment for HER2 positive, HER2 negative, PR negative breast cancer. I've undergone with chemotherapy treatment for 5 months with paclitaxel. Still had 11% of cancer remaining after stopping this treatment due to the adverse side effects to my healthy cells. Followed a powerful food supplement repurposed drug therapy for the following 2.5 years. Due to progression to the brain 2.5 years later, started a chemotherapy protocol that includes the following medications. Okay, since utilizing these protocols, the cancer has shrunk. however, and in small amounts. I've been taking 12 pumps of Valasta for 1.5 months since mid-May. I'd be curious to know if the Valasta is actually aiding in the shrinking of the cancer. Since taking Valasta, my quality of life has increased greatly. However, my cancer marker has increased to the top of the normal range. Okay, don't panic about that, because when the cancer dies, it gives you a false positive and a false climb out of your cancer markers. Keep in mind that the chemotherapy medications make me extremely hungry. I find it difficult to refrain from eating animal products and at times higher amounts of simple carbs. I eat constantly, even through the late night hours. My A1C has increased as well. Also, since taking the chemotherapy medication, I've been able to gain weight. Prior to the second round of chemotherapy, I was unable to budge my weight above 104 pounds. I am 5'6" tall. However, now I weigh 125 pounds. I'm trying very hard to refrain from eating animal products and simple carbs. Is it your professional opinion that Valasta will work synergistically with the chemotherapy drugs I am taking at this time? Yeah, I absolutely support that. Your diet. One of the worst things that a cancer patient can do is lose weight. It's a sign that the cancer is consuming the nutrition. So when you see your weight gain start to come back, especially after Valasta, we see that very, very frequently. That's a very good sign that the cancer is now dying. Cancer has priority over the sugar that your liver produces, the glucose that your liver produces in a process called, it converts the glycogen, it's glycolysis, but it converts the glycogen into glucose. About 80% of the sugar that your body uses is produced by your own body. It's not what you ingest in your diet. If you are eating red meat, I'd ask to cut that back simply because of the ferritin or the iron content in the red meat. And cancer cells have a tendency to accumulate iron to generate more free radicals that they use as weapons to kill adjacent cells and also to lower the pH. So if you can switch your meat to chicken or fish, that would be better. But remove all alcohol, all fructose from your diet. Those are the two single largest contributors to cancer generation and progression. So be very, very diligent in that. Stella asks, I lift weights every day and do cardio several times a week, wondering if that would change CRP numbers. I lift to failure a couple times a week and do get quite a bit of muscle soreness. Also, what about Valasta and uterine endometrial cancers? Haven't seen that come up in comments or on search engines. Love Valasta, and it will be a supplement. I never run out. Thanks for the question sessions as well. So informative. The problem I have with exercise, although everybody should do some form of exercise, even if it's walking, but any time that you lift to failure or you run to muscle fatigue, that's called an anaerobic condition. It generates a huge inflammatory response in your body. It takes you several days to recover from that. It's also a very a strong precursor, if you do it chronically, to maintaining an inflammatory disease state in your own body. Marathon runners, for example, we see have the highest, per group, have the highest concentration of skin cancers, melanoma, basal cell, squamous cell type cancers. And everybody thought for the longest time it was because they're outside and they're exposed to UV radiation. The reality is that that's not the case. What's happening is when they're running marathons, their body is operating in an anaerobic state, and they're generating a huge concentration of lactic acid. But the other thing that's happening in the skin is the largest organ on our body. When you begin to stress your body, that's done typically in a marathon, your blood flow is redirected to your brain, to your organs, to your muscles. And that those capillaries on your skin will tend to close off and squeeze that blood into the more vital areas to keep you going. What that does is it creates an anaerobic condition in your skin cells, causing a very high concentration of free radicals to accumulate in your dermis and your epidermis layers. And when that happens, now cells are not getting the blood flow, and they have two options. They are either going to go into apoptosis and die, or the DNA is going to be damaged and you're going to end up with small spots of cancer, melanoma. All cancers are anaerobic, 100%. And we know that they come from anaerobic behaviors. Anytime that oxygen is deprived, your risk goes up of one or more of those cells becoming anaerobic and operating like a yeast cell. And when that happens, we call that cancer. So always keep that in mind. Working out to fatigue is not necessarily the best thing you can do. If you're young, you can get away with it because you have glutathione. But unfortunately, the bad habits we generate when we're young, when our glutathione production is curtailed in women after age 42 and men after age 50 on average, and our habits haven't changed, whether they're eating habits or exercise habits, we are probably going to end up with a pretty serious problem. Now, Kathleen asks an interesting question. If a person needs 28,000 international units of D3 to keep 25-hydroxy above 50, does the inflammation caused to process the supplement adversely affect Valasta's benefits? It does not. 28,000 international units of D3 means that you probably have a pretty severe deficiency. And in some communities, we see very, very low D3s. In the Black community in particular, they probably 80 to 90% of them are deficient in D3 simply due to the color of their skin. So it is something that you want to monitor. A low D3. D3 is involved in a lot of anti-disease type states. So getting deficient in D3 can have a very detrimental effect on your overall health. So with that in mind, but D3 is also processed through the liver, like vitamin C, vitamin A, vitamin B, and it does have an inflammatory response. But the National Institute of Health is showing that the benefit of D3 far outweighs the negative effects. If you're taking Valasta, you completely improve the benefits of it by reducing any form of inflammatory response that the D3 may be giving you. So using Valasta in conjunction with any vitamin that is a pro-oxidant is an absolute, probably a requirement if people knew about the inflammatory response from excess vitamin supplementation. Brenda asks, last Friday you spoke briefly about fructose. I eat berries quite a lot for breakfast. Is this something I should do or something I should not do? If not, what do you recommend for breakfast? Fructose is one of those things that in alcohol, they're both processed the same way. They cause chronic inflammatory disease. We were designed to eat fruit and satisfy our little desire for sweetness maybe 2 months out of 12. When fruits became ripe, we were given the ability to go ahead and eat those fruits, and what the trees were getting out of it was obviously spreading of the seed around on the planet. But as we ate fruit, we did generate a huge inflammatory response. So people could get very, very sick. Animals will also get sick from inflammation. Some animals actually get drunk in the processing of fructose into ethanol. But We don't. So, but we do get an inflammatory response. Now, when we typically would eat fruit, so in November, December, January, February, March, April, May, June, July, August, we start eating fruit. September, we eat fruit. October, we eat fruit. The apples come ripe. So we would eat the fruit during that period. But then we would have 10 months to recover from the inflammatory response of that. Now, today, we're at a much higher level. We eat fruit every day. We eat fruit. We maintain a very high inflammatory disease state, and it does not give our bodies time to recover from that. So when we eat fruit every single day, we are maintaining an inflammatory disease state. So that is very serious to keep in mind. In my situation, I eat very little fruit. I don't have any fruit for breakfast typically. My breakfast consists of, and everyone will get a kick out of this, but my breakfast is bacon and eggs every morning. No sugar, no fructose. My C-reactive protein is less than 3, and I maintain it there. If you see your C-reactive protein getting greater than 3, the first thing you should do is cut out your fructose and your alcohol, at least reduce it dramatically, your consumption of fructose and alcohol. So, my cholesterol, by the way, I've eaten bacon and eggs that way for 30 years. My cholesterol is about 150 to 170. So I'm in pretty good shape. But I keep my C-reactive protein less than 3. Yuri asks, I have read that hydrogen gas and drinking hydrogen water does an antioxidant effect similar to Volasta. Do you think it may be beneficial to use them in addition to Volasta? For example, taking Volasta with hydrogen-infused water, or the effect of it would be negligible. Let me show you a chart here of solubilities of hydrogen in water. Here's a chart, and it starts off with acetylene. These are in grams per liter. And look down at hydrogen underneath ethylene there. 0.00016. Hydrogen is insoluble in water. So if somebody's trying to sell you hydrogen dissolved water, it's a lie. It's a myth. Hydrogen is insoluble in water. Look at nitrogen and oxygen gases. They're 10 times more soluble than hydrogen. Hydrogen does not like to be in water. So when they bubble hydrogen through water and they sell that to you, there's no hydrogen in that water, nothing that's going to make any difference. Now, hydrogen ions, H plus, is the basis of whether something is an acid or a base. So if the hydrogen ion, like in hydrochloric acid or sulfuric acid or nitric acid, they all donate a hydrogen plus to the solution, which lowers the pH, makes it very acidic. So there's a huge difference between hydrogen gas and the hydrogen ion. And hydrogen gas is insoluble in water, so there's none in there. So please be aware of that and don't get taken on that complete myth. Second question is Wim Hof's breathing method not compatible with the Volasta protocol? His breathing method is trying to maintain high oxygen levels. This is a much simpler program. Just go buy an oximeter for $19 on Amazon, put it on your finger, and make sure your O2 level is 96% or greater. If it's less than 96%, Breathe in deeply and exhale over and over again until your O2 level gets above 96%. If your O2 level is maintained chronically at levels below 92%, you're going to enter into certain parts of your body being in an anaerobic state, and it's going to increase free radical concentration. And you can measure your C-reactive protein and monitor that and correct it at that point. With that, that's the end of the questions. And I want to thank everybody for sending them in. Keep them coming. They're very good discussion topics. And hopefully I'm adding to the knowledge base of everyone in managing their overall health and well-being and the quality of their life. God bless and stay tuned. Thank you.